Good morning, and welcome to the CalPERS webinar, Open Enrollment. We'll be explaining a lot of information today, so I'd like to mention that this webinar, like our previous webinars, will be available on our website as a video. So if you'd like, you can watch it again. To find our videos, start at our homepage at calpers.ca.gov, scroll down until you see the Videos section, and then select the View CalPERS Videos link. This brings you to the CalPERS YouTube channel. Search through the Member Retirement Benefit playlist or the Health Benefits playlist to find our previous webinars. Choose a video and start watching. We'll be talking about a few publications during this webinar. The publications we mention can be downloaded from the Forms and Publications section of our website. Throughout this presentation, we'll be talking about your myCalPERS account. If you're not familiar with myCalPERS, it's your gateway to conducting business electronically with CalPERS. Use this secure website to access real-time details about your CalPERS account. If you haven't yet opened your account, select the orange myCalPERS login button located at the top right of most calpers.ca.gov pages and follow the steps to register. Here's what we have to cover today. We'll be discussing what open enrollment is, the different materials and publications available to help you with your open enrollment decisions, and several of the online resources available. Lastly, we'll look at open enrollment for dental and vision benefits. Let's get started. So what is open enrollment? Open enrollment is a yearly event held in the fall for those eligible for CalPERS health coverage. Open enrollment is when you're able to make changes to your health coverage. The specific dates of open enrollment change every year, so you'll want to check with us to confirm when it's happening. Any changes made during open enrollment take effect January 1st of the following year. During open enrollment, you can enroll in a plan, change your plan, add eligible family members, delete dependents, or cancel your coverage altogether. Keep in mind, you don't need to wait until open enrollment to delete dependents or cancel your coverage. You can do those things anytime during the year. There are, however, some situations where a deletion of a dependent is mandatory. For example, when your dependent child turns 26, they are no longer able to be covered under your CalPERS-sponsored health or state dental plans. This deletion is mandatory and automatic unless they can be certified as a disabled dependent. So let's take a look at some important open enrollment materials and publications. A few weeks prior to open enrollment, we post the open enrollment packet online. For those who have chosen to receive it by mail, it's mailed out at this time as well. This packet includes the health plan statement, which is available in your myCalPERS account, and the open enrollment newsletter. The open enrollment newsletter contains health program highlights, changes to health benefits, and other important information. Even if you don't plan on making any changes for open enrollment, you'll still want to review the health plan premium rates for the next year. Rates change every year, and you don't want to be surprised by an unexpected rate change. The health plan statement is sent out every year by mail for those who have chosen to receive it that way, and is available to download online in your myCalPERS account. The health plan statement is a snapshot of your health enrollment as of August 1, so if you make any changes effective after this date, they will not be reflected in the statement. The statement shows the health plan that you're enrolled in, your eligibility zip code, which we use to determine what plans are available to you, and also who's enrolled in your plan. Your health plan statement will also provide you with an all-inclusive list of the health plans we offer and some resources and tools available to you, a few of which we'll be discussing shortly. Let's move on to one of the most useful publications available for open enrollment, the Health Benefits Summary. This publication contains a wealth of information regarding specific plan benefits, but it contains more than just benefit information. If you've ever wondered about the differences between the health plan types, this chart in the Health Benefits Summary may help you. It describes different health plan features and how the HMO, PPO, and EPO plan types differ. For example, if you need to see a specialist An HMO requires that you seek approval in advance. But with a PPO or an EPO, there is no prior approval necessary for many specialist services. Also in the Health Benefit Summary is the Health Plan Directory. This provides you with all of the plan's phone numbers and website addresses so that you can find out more about ID cards, deductibles, limitations, or if you have specific coverage questions not answered in the Health Plan Summary. And finally, there are the benefit comparison charts. These are side-by-side descriptions of what the plans cover. The comparison charts are separated by basic or non-Medicare plans and the Medicare plans. Please keep in mind that these are just summaries of the plan benefits. While they do include the most popular benefit features of each plan, they are still only summaries. If you have additional questions not covered by the Health Benefit Summary, please contact the plans themselves. We cannot answer coverage questions. The evidence of coverage publications are a more detailed description of the plan benefits and limitations. These publications are generated by the plans themselves. They are not CalPERS publications. We link to the evidence of coverage publications on our website under the Forms and Publications section, but because they have to be sent to us by the plans, these links may not be available during open enrollment. If you'd like a paper copy sent to you, you'll need to make this request directly to the plan. There are a lot of online tools and resources available to help you make any open enrollment decisions. An excellent source of information on the available CalPERS health plans are the plans and rate pages on our website. There are two versions of the plans and rate page, one for active employees and one tailored for true retirees. To get there, select either active members, then health benefits and plans and rates, or select retirees, then health and Medicare, then retiree plans and rates. If you're an active member and you find yourself on the retiree plans and rates page, there's a link that will take you directly to the active member page. There's a similar link on the active members plans and rates page. The first tool I want to call to your attention is the Health Plan Search by Zip Code tool. You can use this throughout the year to find out what plans are available in your area, and it's available on both the active and retiree pages. Enter your current home zip code or the zip code you're planning to move to, choose the correct member category and the search year. You'll be provided with the HMO, PPO, and association plans available, separated by basic, Medicare, or the combination of the two. This tool is really helpful when you're planning a move, becoming eligible for Medicare, or during open enrollment. When you keep scrolling through either of the plans and rates pages, you'll find the health plan rates for all our health plans. They are separated by year and by employment category. State and California State University retirees and active members will find their plans rates and state contribution amounts. Public agency and school retirees and active members will find their rates separated by region. Another useful aspect of the Health Plan Search by Zip Code tool that we just talked about is that it will tell you what region you're in when you enter the required information. Employer contributions are not posted here because they vary by employer, but we'll show you where your employer contribution may be found in a few minutes. Even if you don't plan on making any changes during open enrollment, make sure to always check the health plan rates and employer contributions. There are some really useful tools and resources in your myCalPERS account as well. Let's take a look at the Health Plan Summary page. This shows you a lot of information about your current health enrollment and dental enrollments, if applicable. The page shows what plan you're currently enrolled in, your share of the premiums, your employer's share, and the total premium. And when you scroll further down, you'll see who's currently covered on your plans. This is a great way to get a real-time view of your health enrollments. In addition to the Health Plan Summary screen we just reviewed, the myCalPERS Health section offers these choices. The Search Health Plan tool in myCalPERS enables you to search for and then compare the features of available health plans. The Health Costs into Retirement calculator enables you to find out how much health benefits will cost you in retirement. The Health into Retirement calculator is intended to provide an estimate only. Your actual health benefits will be determined when you formally apply for retirement. This tool is only available to active employees who are eligible to retire. Finally, the Open Enrollment link provides information about the changes possible during Open Enrollment, as well as some publications and other resources available. We've reviewed many of these items in this webinar. Retirees also have the option of making health plan changes through this link during Open Enrollment. Active employees need to make any changes through their employers. If you make a change online during Open Enrollment but then change your mind, if you are a retiree, you can call us to cancel your transaction. This is called a rescission. Active employees would work through your employers to rescind a transaction. If you want to rescind your Open Enrollment transaction outside of the Open Enrollment window, you can only request to go back to the plan that you were previously enrolled in as long as you're still eligible for that plan. For example, if I decided after Open Enrollment that I didn't want to change my plan to Kaiser and I wanted to keep Blue Shield, I can call or write in any time before the plan change takes effect and request to rescind the plan change to Kaiser. This is only allowed if I'm still eligible for the Blue Shield plan I was enrolled in previously. But what if it's still Open Enrollment and I want to cancel my change to Kaiser, but don't want to go back to Blue Shield? I can do that and choose a different plan I'm eligible for, but only if it's still during the Open Enrollment period. You can call us at 888-225-7377. Most requests can be completed over the phone. You can also submit your Open Enrollment requests by mail or fax. And although our regional offices are currently closed due to COVID-19 restrictions, when they reopen, you'll be able to walk into a regional office to submit your request in person. Again, active employees need to make health plan changes through their employers. Open Enrollment may also include changes to dental and vision benefits. If you're an active employee and you need to make dental and vision coverage changes during Open Enrollment, state employees will contact your personnel office. California State University, you'll contact your campus benefit office. And school and public agency employees will contact your personnel office. To change dental or vision coverage, state retirees would contact CalPERS at 888-CalPERS, which is 888-225-7377. California State University retirees also contact CalPERS at 888-225-7377. If you retired from the California Highway Patrol, are a member of CAHP, the California Association of Highway Patrolmen, and have chosen CAHP for your dental plan, that plan is administered by CAHP. For those eligible for dental through the state, CSU, or CAHP, Open Enrollment for dental is at the same time as Open Enrollment for health. Although we don't administer the dental or vision programs, we process all of these dental transactions for retirees. So if you want to make changes to your dental or vision plan during Open Enrollment or any time during the year, give us a call. School and public agency retirees will want to contact your personnel office. For state retirees, dental information, including a summary of dental plan choices, coverage, and cost information, premiums, and the dental plan enrollment change request form can be found on the CalHR website at calhr.ca.gov, and then select State Retirees, then Retirement Benefits, and Retiree Dental Benefits. If you've been enrolled in dental as a retiree before, most Open Enrollment requests can be processed over the phone. But if you're enrolling for the first time as a retiree, you'll need to submit your request in writing. To do so, you can submit the Dental Plan Enrollment Change Request form found on the CalHR website, or you can submit a letter directly to us that includes your full name, social security number, and date of birth, your daytime phone number, the agency that you retired from, the bargaining unit that you were employed under, and the name of the plan that you wish to be enrolled in. You'll also want to include the names, social security numbers, and dates of birth for any eligible dependents you want to enroll. Don't forget to sign and date your request. CSU retirees can get more information on their dental benefits by visiting the Chancellor's Benefit website at csuretirees.calstate.edu/dental. Here you will find benefit information, evidence of coverage publications, and retiree dental enrollment change request form if you are enrolling for the first time. If you prefer not to use the form, you can send a letter with the same information mentioned on the previous slide. If you're eligible and would like more information on the CAHP dental plan, you can review the information on their website at www.thecahp.org. Please note, once you enroll in the CAHP dental plan, you cannot change plans. For state retirees, vision benefits are administered by CalHR. And for CSU retirees, your vision benefits are administered by the Chancellor's Office. All coverage, benefit, and enrollment information is handled by Vision Services Plan, or VSP. To make changes, contact Vision Service Plan. For state retirees, you'll call 800-877-7195. CSU retirees, call 800-400-4569. For school and public agency retirees, you want to contact your personnel office about any vision plan available. Open enrollment for vision coincides with our health and dental open enrollment. VSP, or Vision Service Plan, will send open enrollment materials and they complete any transactions. Retirees commit to a minimum of 12-month enrollment during open enrollment and can only cancel if a permitting event occurs. If you sign up at the time of retirement, the commitment will be for 12 months plus the time until the next open enrollment. Premium payments can be withdrawn from your retirement check as a direct authorization. We went through a lot of information today regarding open enrollment. Our presentation today was intended to provide you with some information about open enrollment. Remember, this was a brief overview. You can find more detailed information on our website and through the publications we've recommended. Like we mentioned before, this webinar and all of our webinars become available as videos on the CalPERS YouTube channel, which you can access from our website at calpers.ca.gov. Thank you for taking time out to attend this webinar and have a great rest of